everybody, Dr. Ryan here. Hope you and your folks are well. Thank you so much for joining me today, even as we undertake a head-to-toe clinical approach to the problem of Cushing syndrome. If you haven't yet subscribed to my channel, I strongly encourage you to do just that. Alrighty, so there's our handy gentleman here. So first up, guys, it's good to introduce yourself to the patient, position the patient appropriately, so ideally Fowler's or semi-Fowler's position, obtain adequate exposure. Secondly, as usual, we step back just to inspect the general appearance of the patient. You want to determine, usually the patient has a certain degree of obesity, and you want to calculate what percentage of ideal body weight they fall into. Then usually it's truncal obesity. So the conventional teaching is that lemon on a matchstick appearance, right, with central obesity, right, lemon on a matchstick appearance, right, so thin limbs and you got central adiposity. And the affect can be depressed or euphoric, because you know that Cushing's can affect the mood as well, right? And as you progress up, you find the patient has hypertension. Now, regarding the skin is very fine and fragile. Classically, the place you want to look for the skin thickness, especially in young females, is behind the dorsum of the non-dominant hand. The skin fold thickness should be at least 1.8 millimeters. If it's less than that, it's fragile skin, probably on the basis of hypercortisolemia. You may have purpura for the same reason, fragile skin, especially the forearm, with or without pigmentation, especially scars. You may have puffy hands, right? Moving on to the face, you may see a hypophysectomy scar if this was Cushing's disease, which was surgically treated. The moon face is important. You have facial plethora or rubor with acne. You have hirsutism, which is unsightly hair on the face, telangiectasia. If we grab a fundoscope and look into the retina, or looking at the fundus basically, right, you're going to see what you may see along the way is a cataract, which is a posterior subcapsular cataract. You may have changes of hypertensive retinopathy and diabetic retinopathy. And rarely you may have a visual field defect, especially if this is an enlarging pituitary adenoma causing Cushing's disease, which impacts on the optic chiasm. Right, you may have optic atrophy and papilledema as well. Coming down now, just looking at the torso, etc., what we can see is a buffalo hump, which is a dorsocervical fat pad. You may have supraclavicular fat pads, vertebral tenderness, because remember that Cushing's can cause osteoporosis, right? Kyphosis and circular edema. In the abdomen, you have pink livid stria, at least 1 centimeter across, by definition. You may have a palatable mass, if that's the adrenals, albeit not that common. Hepatomegaly on the basis of fatty liver and adrenalectomy scar, if this was Cushing's syndrome, which was surgically treated, right? And the legs, we have proximal wasting and weakness, and hence we have lemon on a matchstick appearance, right? We have very thin limbs with proximal weakness, so hair, stairs, and chairs. They have difficulty classically on history combing the hair, climbing upstairs, and waking up from a chair because of proximal weakness of the pectoral and pelvic girdles, right? They may have purpura because of the fragile skin, they have hirsutism, they have tibial tenderness, they have ankle edema. Your analysis, you can pick up glycosuria, you may have clitoromagaly as well in females. And of course, you may have stigmata of the underlying cause. Steroid-dependent disease, right? Example, patients may be taking exogenous corticosteroids for whatever indication, like is this SRE, is this asthma, is it rheumatoid arthritis, is it skin disease, and those will manifest with their own particular clinical stigmata on their own. All right, so nice to ask some questions to a patient in whom we suspect Cushing syndrome. This is taken from Talley O'Connor, right? And so wherever you see the exclamation marks denote symptoms for the possible diagnosis of an urgent or dangerous problem. And that's number 5. Have you ever felt agitated and been unable to sleep? Then, have you gained a lot of weight recently, and how much can they quantify in the way of pen sizes? Do you bruise easily, speaking to the increased fragility of skin, right? Have your skin become very thin? Have you had any problems with acne? Have you had any problems with weakness of your muscles or difficulty getting out of chairs? And remember, the acronym is hairs, chairs, and stairs. Right? Have you had problems maintaining erections in men, or have had amenorrhea in women? Have you been diagnosed with diabetes? So what are the excellent signs, or the best signs, based on evidence-based medicine, to back up a diagnosis of Cushing's? Firstly is hypertension from your vital signs, body habitus, the lemon on the matchstick, right? Moon faces, central obesity, general obesity. Skin findings, thin skin fold, plethora, hirsutism, ecchymosis, red or purple stria, and acne. And the extremities, we've got proximal muscle weakness and edema. Alrighty. Remember, guys, the differential for Cushing's can be hypothyroidism, can be just simple obesity. It can also be some of the genetic syndromes like Prader-Willi and Lawrence-Moon-Beetle. Causes of Cushing's syndrome, so by and large, the most common cause that we see in practice is patients who are on exogenous steroids for whatever reason, right? Could it be rheumatoid arthritis, or could be asthma, for instance, some examples, or they have ACTH, right, which is Cushing's disease. Adrenal hyperplasia, right, can be secondary to pituitary ACTH production. We have Cushing's disease, which could be on the back of a micro or macroadenoma, or pituitary hypothalamic dysfunction, or it could be secondary to an ACTH producing tumor like a small cell lung cancer, right, which is outside the pituitary. Adrenal neoplasia itself, somewhat less common on the back of adenoma or carcinoma. Guys, we're not going to go through the whole process of investigating Cushing. This is covered in one of my other videos. I encourage you to go and have a look at that. Alrighty, so this is clinical stigmata once more. So what we can see here is the moon facies. Right, let's get my painting there. The moon facies, facial rubor. Acne is not really present, some hirsutism as well. This is a natural aspect as well, demonstrating this dorsal cervical fat band, right, as well. And here we see, I beg your pardon, like sneezing. Oh dear. Excuse me. Alright, here we see central obesity with livid abdominal stria. So we said by definition, this stria must be livid and must be at least 1 centimeter across. Okay, my friends, the book of Philippians chapter 2 verses 14 to 15 says, do everything without grumbling and arguing, so that you may become blameless and pure, children of God without fault in a warped and crooked generation. Right? So in everything we do, in everything we say, in every relationship, in every discussion, right, we must show forth the love of Christ. The Bible says we are the light of the world and the salt of the earth. So we should not grumble, we should not murmur and complain like the Israelites who were complaining, and as a result, that particular generation did not enter the promised land, and they were wandering in the desert for 40 years. We want direction, we want favor and the grace of God upon our lives. So we should try as far as possible to do everything without murmuring, grumbling, and complaining, so that we can show ourselves to be blameless and pure children of God without fault in this generation. God bless you. I'll see you soon with another video in my series, Physician Examinations. God bless you.